Part A. In this part of the test, you'll hear two different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information you hear. Now, look at Extract 1. You will hear a physiotherapist talking to a patient. For questions 1 to 12, complete the notes using a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Welcome, Mrs. Johnson. I see here that you've been referred to me due to some persistent shoulder pain. Could you please share your experience with the pain, how it started, and any details?
Of course, thank you for seeing me. The pain in my shoulder began around 6 months ago while I was doing some gardening in my yard. I remember lifting a heavy bag of soil, and suddenly, I felt this sharp and shooting pain in my right shoulder. At first, I thought it might just be a minor strain, something that would go away on its own with time and rest. But as the days went by, the pain didn't subside, and it gradually started affecting my day-to-day life.
I understand. Can you describe the nature of the pain and how it has been impacting you in more detail?
The pain is a constant dull ache that is always there, but it becomes more intense and sharp when I try to lift or reach for things. Even simple tasks like reaching for a mug or lifting my arm to comb my hair have become painful and challenging. The pain also radiates down my arm at times, making it difficult to use my hand properly. Besides the physical discomfort, the pain is keeping me up at night. Finding a comfortable sleeping position has become a real struggle, and as a result, my sleep quality has significantly deteriorated. I wake up feeling fatigued and drained, making it harder for me to concentrate and be productive during the day.
I'm sorry to hear that the pain is impacting your daily life so much. Have you tried any treatments or remedies on your own before seeking medical help?
Yes, I have. As soon as the pain started, I tried to manage it at home initially. I used heat packs to soothe the area and took over-the-counter pain relievers to alleviate the discomfort. While the heat provided some temporary relief, it never really addressed the root cause of the pain, and the painkillers only helped for a short time before wearing off. I also tried doing some gentle stretches and exercises, hoping they would help, but they didn't seem to make much of a difference.
It's understandable that you tried to manage it on your own, but it's essential to have a professional assessment to address the underlying issue. When you saw your GP, did they provide any specific diagnosis or information about the possible cause of your shoulder pain?
When I visited my GP, she mentioned that it could potentially be related to a rotator cuff injury, but she couldn't confirm it without further tests and evaluations. She suggested that I see a general orthopedic specialist, but I wanted to seek the expertise of a physiotherapist first to explore non-surgical treatment options and possibly avoid invasive procedures.
That was a wise decision, and I'm glad you chose to see a physiotherapist for a thorough assessment. Now, I'll need to perform some physical examinations and tests to better understand the underlying issue and create a personalized treatment plan for you.
Absolutely. I'm more than willing to undergo any tests necessary to get to the bottom of this and find relief from this constant pain.
That's great to hear your commitment. Let's begin with a comprehensive examination of your shoulder. I'll start by assessing your shoulder's range of motion. Please stand comfortably, and I'll gently guide your arm through various movements. As we do this, let me know if you experience any pain or discomfort, and feel free to describe the sensations you feel during the movements. Now, how do you feel?
Well, when I lift my arm above shoulder height, I feel this sharp and stabbing pain deep inside my shoulder. It's as if something is catching or pinching, and I can also hear this clicking sound. The pain is really limiting my mobility, and it's discouraging because I used to be quite active and enjoyed doing various activities without any discomfort.
Okay, the pain and clicking sound you've mentioned could be indicative of a possible rotator cuff issue. However, we'll need to conduct further tests to confirm the diagnosis accurately.
I understand, and I appreciate your thoroughness in investigating the issue. I just want to find out what's causing this pain and discomfort, and if there's a way to alleviate it without resorting to surgery.
You will hear a patient, Emily Johnson, talking to a speech therapist regarding some speech difficulties she has been having. For questions 1 to 12, complete the notes using a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Emily Johnson? Please come in and have a seat.
Thank you.
Great, so I see from your referral that you've been experiencing some speech difficulties?
Yes, that's correct. I've been having trouble with my voice for a few months now. It's like my voice gets hoarse and strained after talking for a while. Sometimes, it even cracks, and I find it hard to project my voice properly. It's been quite frustrating. My primary care doctor couldn't pinpoint the cause, so he suggested I see a speech therapist. I hope you can help me figure out what's going on.
I'm glad you came in. Let's start by discussing more about your symptoms and how they feel.
Sure. The first thing I noticed was this persistent hoarseness that comes and goes. It usually starts with a scratchy feeling in my throat, and then my voice becomes husky and weak. I find it difficult to maintain a clear and steady voice throughout the day, especially if I talk a lot. It's also worsened by environmental factors like dry air or when I'm exposed to certain allergens.
That's important information. Thank you for sharing. Have you noticed if anything triggers these symptoms or if they get better or worse at certain times?
Well, I haven't noticed any specific triggers. It seems to happen regardless of what I eat or my stress. I thought it might be due to seasonal allergies, but it's been going on for several months now, so I'm not so sure.
I understand. Has anything like this happened before, or is this the first time you've experienced these voice issues?
So I had a mild case of laryngitis a few years ago, but it resolved on its own after a week or so. This feels different and more persistent.
All right, it's good to know your medical history. Now, have you had any recent illnesses or injuries that might be related to your current voice problems?
No, there haven't been any recent illnesses or injuries that I can think of. I'm generally in good health otherwise.
Thank you for providing all this information. I'll perform a comprehensive evaluation to assess your vocal cords and speech patterns. Based on our initial discussion, it's possible that you may be dealing with vocal cord strain or some other vocal issue. We'll get to the bottom of this through the evaluation.
That sounds reassuring. I'm eager to find out what's causing these problems.
Don't worry, we'll work together to find the best course of action for your voice therapy. Let's get started with the evaluation, and we'll take it from there. Emily, based on the evaluation, I can see that there is some inflammation and irritation in your vocal cords, which is likely causing the hoarseness and strain you've been experiencing. This condition is known as vocal cord nodules.
Vocal cord nodules? Is it serious?
Vocal cord nodules are common among individuals who use their voices extensively, such as singers or teachers. They are small, callus-like growths that develop on the vocal cords due to excessive vocal strain or misuse. While they are not typically serious, if left untreated, they can lead to chronic voice problems.
How can I treat them?
The primary treatment for vocal cord nodules is voice therapy. We'll work on techniques to help you use your voice more efficiently, reduce strain, and improve vocal cord coordination. In some cases, vocal rest and hydration can also be beneficial.
Okay, that sounds manageable. How often do I need to come for therapy?
Well, initially I would recommend weekly sessions to get you started on the right track. As you progress and your voice improves, we can adjust the frequency of sessions. It's essential to be patient with the therapy process, as it may take some time for the vocal cords to heal and for you to notice significant improvements.
I'm willing to do whatever it takes to improve my voice. Can I also continue speaking in public and attending social events?
While it's essential to reduce vocal strain, you don't have to avoid speaking altogether. I'll provide you with guidelines on how to protect your voice during social interactions and public speaking engagements. Learning to use your voice more efficiently will help you participate in these activities without exacerbating the condition.